Hello, my name is Joseph Kelly. I work for Planmeca USA, and today we're going to be learning about the Planmeca Pro 1 Panoramic X-ray. I think we should start today with a few of the external buttons on the machine. First of all, the power button. Won't be able to see it, but it lives right at the bottom of the column. It's a side-to-side toggle. Turn the machine off at the end of the day. Turn it on first thing in the morning. There's no reason to turn it off multiple times throughout the day. It'll take about 30 or so seconds to boot up. When the user screen appears after the intro, the machine is on and ready to go. The only other external button on the machine is the emergency stop switch. It's this red button on here. So the assistant side of the machine, patient side of the machine, if anything goes wrong during the exposure, all you have to do is slap the emergency stop switch. That will remove any function from the X-ray. If you had to at this point to get your patient out of the machine, you could even rotate the tube head to get it out of their way so they can safely back out. This particular button does need a release in order to make the machine operate again in the future. So if we give it a little twist, it'll pop out, the machine will reset, we can clear the error, and you're ready to go for your patient. In between patients, you will need to wipe down a few things. The patients will have a hold of the handles, the temple supports will make contact with their head, and their chin will be on the chin rest. So in between patients, wiping down the temple supports, wiping down the chin rest, wiping down the handles with a non-alcoholic wipe is preferable. The bite stick, you have 10 of them, they are autoclavable. Anything gray on the machine is autoclavable. So that's mostly to do with how to handle the X-ray. Let's take a quick look at the software over here. Before we bring the patient into the room or before we start positioning the patient, we always have to bring up the software to get ready for capture. So right now I have the software open, I have our patient selected up at the top. My acquisition button is over here in the corner. It says pan exposure. I click on the pan exposure. Within a few seconds we are waiting for exposure. So now the computer is 100% ready to capture an X-ray. Before we bring in our patient and we start our preparation, we should make sure that the X-ray is 100% ready to take the image. So if we look at this, we're in the Panoramic program up at the top. We are taking an image on an adult female today. So I have 4 settings down at the bottom, starting on the right-hand side, adult male, adult female, young adult, and child. The third thing I have to select is the patient's jaw size. So we have 9 different jaw profiles to accommodate any patient that you could possibly create. 95% of all adults will live right there in the middle with a normal average jaw profile. Usually when we deviate from this, either we have a wide profile or a narrow profile. Less than 5% of your patients will live outside of this middle strip. Every once in a while you will get a V-shaped profile or a box-shaped profile. And as you can see, we have small, average, and large jaw sizes for both V-shaped, normal, and square. I've already taken a look at our patient. She has a lovely average jaw size. So we'll just go ahead and select that. Now the X-ray is 100% ready. So now we're going to bring in our patient. And she did very good in preparing herself. We have no earrings, no necklace. Basically anything that you put on your patient in between C7 and C1 is in your image. So if the patients are wearing big baggy jackets or anything that would interfere with that area, we want to remove it and give ourselves a best chance for a good exposure. State of California does require that we use a lead apron. So we're going to use one of those.
Turn around. Oh, no.
Go this way.
Okay.
And just like we talked about anything on the back of the patient's neck, if you notice, we want to keep the lead apron really low in the back. If you put that lead apron above C7 on the patient's neck, you'll see a very white, sharp spike at the bottom of your image, which most doctors are very unhappy with. So first thing I want to do is lower the machine down. I have 2 arrows up and down on the machine. If I hold the button down, it will shift into a higher speed. It moves very slow at first in case the patient's mouth is on the bite stick. There are 5 steps to panoramic positioning. So in the order that I give them to you, it's very important that you try and follow them in that order. I know you will all know these steps, but if you follow them in a particular order, you'll be very proficient at taking the images. So the first thing I'm going to try and accomplish with the patient is get her neck nice and straight. So her cervical vertebrae from C7 to C1 needs to be perpendicular with the floor. So in order to do that, what I'm going to ask the patient to do is please step up to the machine. I'm going to place the chin rest just above the patient's chin. That's a little bit too high. But you never really want to bring the patient in low. You always want to make the patient try and stand up as straight as humanly possible. So now that we're at the level of the chin rest, what I'm going to do, just pass in front of the camera, is I'm going to ask the patient to tilt her head back, lean forward, open your mouth, bite onto the bite stick, a little bit more forward, right there, and slide your teeth back into the grooves. Okay? Here are the handles. Patient can't see the handles, so you have to show them where they are. And if you notice, she is still leaning quite a bit forward in order to get to that x-ray. So what I'm going to ask her to do is shuffle her feet forward and open them hips width apart. And just like you're at the gym, I want you to just give yourself a little bit of a pull into the x-ray, just like that, so that you're comfortably standing with your feet underneath you and their hips width apart. So now if we take a look at the patient's neck, it's nice and straight from the bottom to the top. Second step we're going to do, if we come around to the front of the patient, all my laser lights went out, and they will time out after about 30 seconds. If I touch the left to right arrows down at the bottom of the screen, they will all reactivate. So step number 1 is getting the patient's neck straight. Step number 2 is going to be aligning the midline. So this laser line that comes right down the middle of her face. I want to put that laser line in between her eyes and in between her teeth. Do not follow her nose. She's a lovely nose, but it's probably not symmetric on her face like most people are not. Okay? So first thing I'm going to do is I'm going to ask her to loosen up her bite on the bite stick, slide her over just a little bit, bite down, so that the laser line, smile real big for me, is right in between her teeth. And then I'm going to give her a little bit of a lean so that it's right in between her eyes. Okay? Step number 3 is to close the temple supports and check the patient's symmetry. So there is a button on the screen on the bottom left-hand corner down here. It's an arrow with a little slash next to a patient's head. I'm going to press that, and if you notice, the temple supports will close onto the patient's head. How we check the patient's symmetry is we kind of judge the distance from the stick to the patient's orbital. So over on this side, I have just about a finger over on this side. So we're pretty even, so she's very symmetric in the machine. If she wasn't, I would have to grab her head and twist it from side to side to try and even out the distance between the temple supports and the patient's orbitals. Step number 4. I need to get the patient's occlusal plane pointed towards the floor 5 to 7 degrees. How I like to do that is I like to give the patient a little bit of a boost right at the back of her occipital bone to encourage her to stand up straight. Okay? And now, let's come around to the front. Now, I'm going to ask the patient to dip her chin down as I lower the machine. Give the patients very specific instruction about what you want them to do. Rather than just raising the machine up or down without any instruction would allow her to bend her knees or somehow adjust to that. So please dip your chin down as I lower the machine down. And smile real big for me. And so what I want to create is so that the anterior teeth are slightly lower than the posterior teeth. So that the angle of the occlusal plane is pointed towards the floor about 5 to 7 degrees. Which is not a lot. It's very close to parallel. So I'm pretty happy with that right about there. The 5th and final step, all my laser lights are out again, so I'm going to press that little arrow down at the bottom. They all come back on. If you look here from the profile side of the patient, I have a laser line that's illuminated on her left-hand side. And if she smiles real big for me, what I'm going to do, try and go down low when I do this, I'm going to place that right in the middle of number 10 at the gum line. So I need you to smile real big for me. So right about there, you can see it on the tooth, and I'm just interpolating up from the tooth to right in the middle of 10 at the gum line. The last instruction I'm going to give to the patient is please close her lips, swallow, and keep her tongue against the roof of the mouth. When you swallow, your tongue is suction cupped to the roof of your mouth. I need it to stay there the entire time of the exposure. So go ahead and please close your lips, keep your tongue against the roof of your mouth. And you step out of the room, please. So 6 feet away or 2 sheets of drywall are considered safe distance for any dental assistant. The radiation follows the same principles as light, so over distance it disperses. You press and hold down the exposure button the entire time. It is a safety switch, so if anything goes wrong, all you have to do is let go of the button and everything will stop. And I let go of the button too early, so we'll go ahead and return this. When it automatically returns, it will let go of the patient's head. At that point, I like to guide them out of the machine, so please just step back towards my hands. And you did great. Thank you, lovely patient.
You're welcome.
Hello, this is Joseph again, and we're playing with the Planmeca Pro 1 today. We're going to look at how to switch from the panoramic mode to the Bitewing feature, the extra oral Bitewing feature. Yay. So I've already got my computer ready to capture. My patient is very patiently waiting by and completely ready for the exposure. Let's look at how to get the X-ray from the panoramic mode into the Bitewing mode. So up at the top, I have a program area. It says Panoramic Standard now. If I touch that area, it brings me into a program selection. So the Pro 1 takes 5 basic images. It takes a standard pan, it takes an extra oral Bitewing, it takes 2 different TMJ shots, and 1 sinus shot. So if I select the Bitewing program and hit the check mark down at the bottom, you will now see that we have shifted from the panoramic standard mode to the panoramic Bitewing mode. My patient today is an adult female, so I've got my adult female selected, and I have an average normal jaw selected for her, since that is the shape of her mandible. So 5 steps to positioning again, 80% the same as the panoramic. So the first step, I'm going to get the patient's neck straight. Second step, I'm going to do the midline. The third step, I am going to close the temple supports and check the patient's symmetry. Very, very important on a Bitewing to make sure the patient is symmetric. The fourth step is different from the panoramic. On the panoramic X-ray, we had the occlusal plane pointed towards the floor at 5 to 7 degrees. On a Bitewing X-ray, we want the occlusal plane to be parallel with the floor. So that is the only difference between the panoramic exposure and the Bitewing. Fifth step is the same. That little laser line that comes down here on the side, I'm going to put that right in the middle of number 10 at the gum line. So let's see how this works. Lovely patient, if you wouldn't mind, come and step back here around the machine. In order to get the patient's neck straight, I do like to bring her in a little bit high, so I walk her right up to the back of the machine so that the chin rest is just above the level of her chin. And I'm going to ask her to lean her head back, open her mouth, move forward, a little bit higher, move forward, bite down on the bite stick, slide your teeth back into the bite grooves, and slide her down to the chin rest. Again, she cannot see the handles, so I'll guide her hands up to the handles. She does have a pretty good lean to her neck, so what I'm going to do is I'm going to come around to the front of the X-ray. I'm going to grab her by the shoulders, and I'm going to encourage her, give her a little hug, to shuffle her feet forward and open them hips width apart, and just pull herself in closer to the machine. So the closer I can get her clavicle to the edge of this temple support, the more straight her neck will be. So if you look at it, it should be pretty much straight up and down right now. All of my laser lines are out, so if I hit my left to right arrows down here, they will all come back on. So I'm going to lower the machine down just a little bit, just to relieve a little bit of stress from her neck. Midline, in between her eyes and in between her teeth, so if you smile real big for me, I'm going to slide her bite over on the bite stick, no rotating, right there. And I'm going to give her a little bit of a lean, so that it's right in between her eyes. Okay? Step number 3. There we go. I'm going to close the temple supports down here on the bottom left of the control panel. and I'm going to check the patient's symmetry. So from the corner of the orbital back to the stick, how much distance do I have? And I am looking very even on both sides, although my midline has shifted greatly. So a little bit of a lean. Smile real big for me. So I'm going to slide you back over on this bite stick. Bite down. Okay. And a little bit of a lean. Okay. Step number 4, I want the occlusal plane to be parallel with the floor. If you smile real big for me. As you can see, her occlusal plane is pointed towards the sky right now. So I'm going to try and parallel that as best I can. Whenever I raise or lower the machine, I like to grab the patient by the back of the occipital bone and give her a little bit of a boost to encourage her to stand up nice and straight. And now as I lower the machine down, please dip your chin down. Smile real big. We're getting pretty close to parallel to the floor. Take a quick look from the front. So anterior teeth are fairly parallel with the posterior teeth. Step number 5. I'm going to ask the patient to smile real big for me. You can see the laser line over here on the side of her face. I'm going to draw a line up, once I can see it on her tooth, straight to the middle of number 10 at the gum line. Smile real big. So right about there, bisecting number 10, going straight up. Same instructions as before with the panoramic. I'm going to ask the patient to close her lips, to swallow, and to keep her tongue against the roof of her mouth. We're going to step out of the room 6 feet away. Press and hold down the exposure button the entire time. And in order for the machine to automatically return, even after the exposure, I'm going to have to continue to hold down the button until the machine makes it back into the starting position. When it reaches the starting position, when you release the exposure button, the temple supports will automatically release on the patient's head, and then you can guide them back out of the machine. You can step back towards my hand. Thank you, lovely patient.
You're welcome.